Good morning, one and all. My name is Dr. Tamilarasi and my number is T13124. Today I am sharing our experience in IOL per calculation after post-myopic laser refractive surgery. Modern cataract surgery is both a rehabilitative and refractive procedure. In spite of advanced diagnostic and modern IOL power formulae, post-operatively we could achieve less than 0.5 diopters of spherical equivalent in only 80% of the eyes. And the outcomes becomes poorer even after post-refractive cataract surgery. Though we could understand the source of prediction error in these eyes, the solutions for eliminating them remains elusive. So the aim of a study to analyze the results of ASRS post-refractive IOL calculator in post-myopic LASIK patients undergoing cataract surgery. This is a retrospective case series done at the Eye Foundation, Coimbatore. The eyes that had undergone myopic LASIK in the past and subsequently had cataract surgery from Jan 15 to 18 and had IOL power calculation using this ASRS post-refractive IOL calculator was included with a minimum follow-up of 3 months. Eyes were excluded if they have any coexisting ocular pathology and the best corrected visual acuity post-operatively less than 0.2 logMAR, and eyes with any other ocular surgeries, ocular trauma and intraop complications during cataract surgery or LASIK were excluded. After all these, we could include 58 eyes for analysis. After entering all the biometric data into the ASRS post-refractive surgery IOL calculator, it gives the IOL power for each of the method calculated, the minimum, maximum and the average value. The surgeon uses his judgment in terms of refractive target refraction and the IOL power is selected. All the patients underwent temporal clear corneal phacoemulsification with implantation of aspheric intraocular lens. Patient demographics, the mean age was 49.84 years. The mean refractive correction for which LASIK was done was minus 7.7 diopters, and the mean axial length in the group is 27.22 millimeter, and the mean IOL power implanted was 19.07 diopters, and the post-cataract, the spherical equivalent was minus 0.56 diopters. Of the eyes had a myopic result, and 19% of the had minimal post-operative hyperopia. And we all know there are around 20 published ways of calculating IOL power post-refractive surgery, and the errors could be either keratometric refractive index error, which means that all the keratometers measures the radius of anterior curvature and uses a standard index of refraction as 1.3375 to convert it into the keratometric diopters, and it assumes a ratio of constant ratio between the anterior to posterior cornea. But this is lost in post-refractive cataract surgery, and this keratometric index is no longer valid. And all the keratometers measures the paracentral measurements and extrapolates the central corneal power. And this radius error is negligible if the optical zone is more than 6 millimeter. And third generation formula uses the keratometer and the axial length value for calculating the effective lens position. So in post-laser refractive surgery, there is an underestimation of effective lens position and hence the IOL power. So usually these methods used to calculate the after the post-myopic LASIK is grouped into three. One using the pre-LASIK K and the manifest change in refraction. Group 2 including the manifest change in refraction, and Group 3 using no prior data. After this published article by Wang L. in JCRS, who showed that using pre-LASIK K and the manifest change in refraction yielded lowest accuracy. This has been removed in the ASRS calculator now, and it has only two groups. Group 2 using only the manifest change in refraction, and this is multiplied by a fraction to adjust the current K or to adjust the IOL power. And Group 3 uses only doesn't use any LASIK data, and which uses only the current data, and it calculates the K using a regression formula, and or it measures the actual K using the advanced technologies like Scheimpflug and OCT. So when we compared our present study with those of Abulafia et al., who has published the same, our results were in par with Sharma's and better than Haig's L. So to conclude, IOL power calculation after refractive surgery is difficult, and the methods that use pre-LASIK K is no longer valid, and using the ASRS calculator, which is open access, which has simplified the use and coupled with one's personal experience and clinical judgment, is going to give us better results. Thank you.